we're live. At least I hope we're live. This is a new platform that I'm just figured out that now I can do Facebook Live from my Health Advice page as opposed to from my Aviva page. And I think I figured it out. Plus, I know I said 11, ask the healthcare advocate at 11. It's almost 11, being that it's 12. But I said I am not going to ignore this, and I am not going to let the time pass, even though I was delayed by technical reasons. So I am here, and I'm going to talk to you because October is Breast Cancer Awareness Month, for all of those who didn't know, and I'm going to talk to you very briefly today about what do you need to know about early detection for breast cancer, specifically in Israel. Get this question all the time. Because there's certain criteria or certain protocol that are followed in the United States, and which is different than what happens in England, which is different than what happens in Australia in terms of breast cancer for early detection. So I just want to review for those of you who are now living in Israel, what are the protocols of the Ministry of Health in regards to early detection. And what are the standards of practice that actually happen in the medical system when you actually encounter it. So first of all, I'm saying early detection because it's important to distinguish. A lot of people, when they talk about breast cancer, excuse me, sorry. A lot of people, when they talk about breast cancer, they always say prevention. So it's very important to understand that there is no way that we know of in a proven way that can prevent breast cancer. And it's just a thing. We know that in general, having a healthy diet, getting a good amount of exercise, and having a good pattern of sleep can help prevent, we think, the development of some cancers. But again, that's not what we're going on. So we have to say, okay, we can prevent. What can I do to detect breast cancer early? And why is that important? Because A, breast cancer is the most common cancer among women, and B, it is something that if you catch it in the early stages, meaning before it has spread to the rest of the body, it is actually relatively treatable, and its cure rate is extremely high, in about 95%. So therefore, the efforts to detect breast cancer early are important because they can help their survival rate. So that's exactly where we are. That's why there's some things that we could do. For other cancers, let's say we could do these very invasive tests and you could identify the cancer, but the benefits do not outweigh the negatives. So here, in the terms of breast cancer, because the breast cancer rate is 1 in 9, I'm sure you guys have heard of that. 1 out of 9 women have the chance of developing breast cancer over a lifetime. That's your cumulative lifetime risk. Because it's so common, that's why we can do these measures, which are called screening measures, where all the population, including the healthy population, all of them undergo these screening and these checking measures so that we can identify breast cancer cases. Now, anytime you do a screening, and I'm going to talk about that, I've talked about it in the past, and I'm sure I'll mention it again, anytime you do a screening, which is meaning you're taking in a healthy population, doing a certain kind of test to identify who has the disease, you're always going to get false positives and false negatives. False positive means there'll be a finding and they think that it's something problematic, they think it's a disease, and it turns out that it's in fact not the disease. And false negatives is that you're actually missing cases of cancer or the disease that you're looking for. And this is just the fallback or the fallout of doing a screening, and that sort of has to be accepted from the get-go. Okay, so taking a step back, we have 1 in 9, and as we know, Ashkenazi women have a higher percentage of developing breast cancer if they have, because it's more common to have the BRCA, the BRCA1 or 2 gene, which gives them an overall 85% chance of developing cancer. And it's important to know that it is a dominant gene, meaning often in some illnesses, right, you need like one from the mother and one from the father, and only if you have 2 copies, then the child has the chance of, or has a guaranteed chance of having the disease. And that's why we do prenatal testing, and that's why we do, before people get married, and they do genetic testing. But in this, meaning that if you have the copy of the gene, then you have an 85% chance of developing breast and or ovarian cancer, depending on which one. And nope, don't come in yet. Thank you. And and men who have the gene also have a higher increased risk of developing prostate cancer, in addition to passing it on to their children. So it's just something that you need to be aware of. So we have this risk. Okay, we're not scared about it, because just in many other things, we say, okay, what is it that we can do to help ourselves? So there are, let's say, two main things that the protocol is for breast cancer early detection. The first one is called the clinical breast exam, the CBE. And I'm sure over the years you've heard all sorts of things. Those people who grew up in America were for sure told that they should examine their own breasts, check their breasts, and go to the doctor, the gynecologist, to have their breasts examined. The breast cancer self-check has sort of fallen out of favor over the years, based for several reasons, which I'm not going to get into, but one is a large study that was done in China, and for other reasons. So the focus is on breast awareness. And what does that mean? That means that women should be aware of changes in their breast tissue, meaning that if suddenly one breast becomes much larger than the other, or there's like a dimpling of the skin, or like there's something that's pushing out or being pulled in that wasn't there before, that's very important, and it doesn't come with the changes of the breast tissue during menstruation, which is very common for women. So then if the woman notices that, or often it's like a hard, it's a hard sort of like a lump, which is like a grain of rice that she feels or she notices in her breast tissue that wasn't there before, and it's not connected to pain, which is important. Pain is not usually a symptom. So it's very important to, if the woman notices those changes, to go to now here, wait for it, in Israel, it's not the gynecologist who usually does the breast examinations. And that's important to note. The breast surgeons, so a surgeon who has experience in breast surgery, is the one who usually has been assigned to do the physical breast examination. Now, that doesn't mean that gynecologists can't do it. For example, a number of years ago, I was involved. They created a training program for family doctors and gynecologists, women family doctors and gynecologists, to do to learn how to do breast examinations, because it makes it much easier for women to access, and women often want women to examine them, and there weren't very many female breast surgeons who would do the exam. So before you just assume that your gynecologist doesn't know, I would for sure ask them, because some of them are trained, especially if they came from abroad, they have their training abroad, so they have the training. Today, a lot of gynecologists veer away from that because they feel that they don't have enough expertise and they don't want to take that responsibility. But you should know that you first have to ask, but in most cases, it's a breast surgeon who does the exam, and every kupa has a list of surgeons on their list, and you can make an appointment with them. If you feel that you have an emergency and you don't want to wait for the 3 months it's going to take to get the breast surgeon, you can call up and say, like, look, I feel something and I would like to have an appointment immediately. Can you put me in? Go out of your immediate town, meaning look around at all the other towns if you have, especially if you have a car. Even if you drive like a 45-minute distance, you might find it easier to find a doctor who's has more availability further away. And there are hospitals that sometimes have open hours. For example, if you live in Jerusalem, Mount Scopus Har Tzofim has once a week an open clinic where they will just sort of first come, first serve, and you sit there and you're examined. So that's if you feel something and you need to respond on a regular basis. They recommend that every 2 to 3 years, basically from the age of 25, that a woman have her breasts physically examined as a breast cancer early detection. Now, there's some people who say it's not really early because the time you can actually feel something, it's not considered early. But as I say, better something than nothing. And And there are cases that people have found through the physical examination. So that is important to do, and find someone and make an appointment way in advance, because surgeons often are very backed up. And a woman does that until age 50, meaning prior to age 50, having a mammography, which everybody knows is what usually you do for early detection, and it's considered the gold standard, meaning, and I know there's lots of been articles about that, and I'm sure that many people will respond here, you know, about not having, not, you know, having that, not doing mammography on a regular basis because it's not helpful, but it is the gold standard because it still detects cases, and and mammography is an X-ray of the breast tissue, and it is it uses comparison, meaning the best way that you can see is you have one and then you do it in 2 years and you say, oh, look, there's been a change. So that's why it's important that if you're coming from America or any other country, that you bring your previous mammography films with you so that the radiologist can compare them. And there's really no reason. I know in America they start now, the recommendation is 45. It used to be 40, but here it's 50, and that's the recommendation of the European standard, because basically ovulation and menstruation and the hormonal changes connected with reproduction of a woman really affect the breast tissue so greatly that a mammography is not a good tool. An X-ray is not a tool because the tissue is too dense and the nuances are not so relevant. So really you wait till a woman is 50, even if she still has her period, but there's still enough of the hormonal change. She's gearing up toward menopause if she isn't there already. And once every either 2 years or 1 year, depending on the recommendation, every year, and the Coupa will pay for that as a matter of course. Now, depends where you are. Sometimes the Coupa will do their own mammography in their own clinic, and they won't pay for the private clinic. There's more and more clinics that have come that are more comprehensive, meaning you make an appointment, you get there, and you basically are there for 3 hours. You see the surgeon who gives you a clinical breast exam, you do the mammography, the doctor looks at the film right there when you're there. If he thinks there's a problem, he sends you, or she sends you back for an ultrasound, or he could also do the biopsy at that time if he feels like he sees something. So it's kind of like a one-stop deal. So you invest the morning often, but you have everything done at once, as opposed to sometimes having to go back and forth or having to go to multiple places. So if you have with the Coupa a place where you can do a one-stop shop, highly recommended, because it's in time investment, but you don't have the uncomfortability of, oh no, they call you back to come back and do the exam, only because really the film wasn't so clear, and that's why they're asking you to come back. So if you can do a one-stop shop, check out with your Coupa, do that. If you've had former incidents of breast cancer in the past, or you have a family history, you can push the Coupa, even if they have their own local clinic, and they say, no, you go here, and it's not a one-stop shop. If you have any family history, previous incidents of breast cancer, then you can push them and you can say, no, I need to go to this place with more comprehensive, and they will usually give you a hitchhayvut. So know that that's an option. Okay, so those are the two things. We talked about clinical breast exam and when you have to do it. And then we talked about the mammography after age 50 every year, unless, two things, unless you can get a mammography if you feel like, if the doctor finds something he needs to send you for that, or they do an ultrasound if you're premenopausal. And if you have a family history of breast cancer, meaning your mother, your sister, your aunt, or any of those relatives had breast cancer, then they'll usually send you 10 years prior to her diagnosis. So if you have family history, just make an appointment now with a breast surgeon, and then they'll send you on your way. So I hope they gave a comprehensive understanding, talking about breast cancer early detection. So exciting that you joined us here for Ask the Healthcare Advocate live. I hope next Friday I'll be a little bit more on time, 11 o'clock. I hope that this even worked. If not, I'll try something else. Please feel free to send in your questions, so I can be happy to answer specific questions. And feel free to comment on anything that I said in this video. Thanks so much for joining us.